Hello and welcome to McLaren Port Huron's Today's Health. I'm your host, Barb Winters. Have you ever felt like, gee, my heart skipped a beat or my heart is racing? Should I see a doctor? Is this important? Well, here to answer all those questions and more is cardiologist Dr. Sivaji Gundlapalli. Dr. Gundlapalli, welcome back to Today's Health.
Thank you for inviting me, Bob. I'm glad to be here.
Well, this is a really interesting subject to me because we're used to talking about the plumbing of the heart, but the electrical system, how does the heart keep its rhythm? Can you tell me about that?
Well, electrical system of the heart consists of a battery in the right upper chamber of the heart, and that has intrinsic property where it generates electric impulses about 60 to 100 times a beat. We do have an image that explains the electrical system of the heart. This is an image of the heart cut half, and we are looking inside. And I would like to concentrate on the few items here. There are 4 chambers of the heart, 2 on the top, we call the left atrium and the right atrium, and 2 pumping chambers at the bottom of the heart. It's called left ventricle and the right ventricle. And these yellow structures represent the electrical system of the heart. If you could look at this top portion on the right atrium, button-like structure here, this is called a Sinoatrial Node, or the natural battery of the heart. That generates electrical impulses about 60 to 100 a minute. Wow. And those electrical impulses propagate through these fibers here, first to the top chambers of the heart on both sides, and make them squeeze the blood. And the blood flows to the bottom chambers. Electricity then finds its way to the bottom of the heart. In order to reach the bottom of the heart, the electricity has to flow through this structure we call the AV node. It takes some time to go through this node, and once it goes to the bottom of the heart, electricity is conducted by a cable on the left side we call the left bundle, and another cable on the right side called the right bundle. And once this activates these 2 chambers, that impulse is gone. And then the next impulse comes, and they have a regular pattern of coming. I have a next image which may, if you plot what I explained on a paper, this is how it pans out. This small blip represents the activation of the top chambers of the heart, and this represents the time it takes to go to the bottom, and this signals the activation of the bottom chambers of the heart. And as you could see, there is a nice relationship between the top chambers and bottom chambers being activated, and then this occurs at regular intervals. So there are about 4 things that we should think about regular heart rhythm. One is the electrical activity comes from the battery, natural battery, and then it takes time to go to the bottom of the heart, and it has a rate about 60 to 100, and it happens regularly, and there's a nice synchronization between the top and bottom chambers. Those are the 4 factors that signifies sinus rhythm or regular rhythm.
Well, what is a cardiac arrhythmia then?
Well, anything that comes out of this normal rhythm, it becomes an arrhythmia. Let's say if the rate is less than 60 at rest, or if the rate is more than 100, that becomes arrhythmia. So if it is slow like this, where the heart is slower, it's called bradyarrhythmia. Or if it's faster, where the heartbeat is happening too often, then it's called tachyarrhythmia. Or if it happens irregularly, then it's called irregular heart rhythm.
What causes then this irregular, this sequence that is so predictable, what causes an arrhythmia?
There are several factors that bring it on. One of them is anxiety, stress. Wherever adrenaline goes up, that can make the heart beat irregular. Alcohol intake, that can sometimes, especially binge drinking, can make the heart become irregular. Street medication or street drugs like cocaine, amphetamines can make the heart become irregular. Excess caffeine, I told you already. And some of the prescription drugs or the over-the-counter medications can make the heart become irregular. Or some of the diseases within the heart itself, with heart muscle being weak or too thick, or the valves dysfunction, heart attacks, inflammation of the heart muscle, or some of them could be congenital. People are born with a tendency, some of them called WPW syndrome, Brugada syndrome, and other congenital problems that make you prone to get arrhythmias.
So what kind of symptoms do you get then when you have an irregular heartbeat?
Well, it could vary. Sometimes it could be just a skipping of the heartbeat, or sometimes it could be a sustained palpitations, or you can have chest pain, shortness of breath, dizziness, syncope with sort of passing out, or fainting spells. Those are all the symptoms of arrhythmias.
How do you know when you need to see a doctor? Because I'm picturing that these are on a continuum, and some of them are very bad and some of them are pretty much okay.
Yeah, you're right. Some of them are very benign, some of them are very dangerous to the life. So if you're otherwise healthy and you're feeling occasional skipping of the heartbeat, and if you can relate to drinking too much coffee, stress, maybe something you can watch and see. And if they become more frequent, then of course you have to go and see a physician. But if you're having chest pains, fainting spells, shortness of breath, those symptoms will prompt you to go see a doctor right away.
Absolutely. Well, we've got a lot more to talk about, but we're going to take a break first, then we'll be right back.
Thank you.